Finding a lump in your breast, wow, that's a moment that can just stop you in your tracks, right? It's so stressful and your mind can immediately start racing. So, in this explainer, we're going to walk through the established step-by-step medical process that follows so you can feel informed and hopefully a little more empowered about what comes next.
Okay, so you've found a breast lump. What happens next? This is the central question we're here to break down. And the very first thing to know is that while it's a totally unnerving discovery, you are not in uncharted territory. Not at all.
You know what's so important to remember is that medical experts have a very systematic approach to get you clear answers. This isn't about guesswork. It's about following a reliable process that starts with a simple clinical evaluation.
So let's start right at the beginning. You or your doctor find a lump. The very first thing that happens is a healthcare provider does a clinical breast exam to figure out, what exactly are we dealing with here?
So, what are they looking for? Well, they're trying to define what they call a true mass. They're feeling for something that's three-dimensional and feels, separate from the tissue around it. And you can see the typical contrast here. A cancerous mass often feels firm, with kind of irregular edges, while a benign one might feel softer, maybe even a little rubbery and movable. But, and this is a big but, a physical exam alone is never enough to be certain. And that's why the next step is always imaging.
All right, so after that physical exam, imaging is the crucial next step. It's really the standard of care for getting a much clearer picture of what's going on, and it gives your doctor some really vital information.
Now, what's interesting is that the approach to imaging isn't one size fits all. It's actually based on your age, and these are recommendations from the American College of Radiology. For women under 30, an ultrasound is usually the first stop. If you're between 30 and 39, it could be an ultrasound or a mammogram. And for women 40 and over, a diagnostic mammogram is the standard. Why? Well, it's mostly because breast density changes as we age, and these guidelines are designed to get the clearest possible picture.
After your imaging, you're going to get a report that uses a system called BRATS. The easiest way to think of it is as a universal language for radiologists. It's just a score, from 0 to 6, that tells your doctor how suspicious or not suspicious the finding is. A low score, like a 1 or a 2, is great news. That means negative or benign. As the numbers get higher, especially into 4 or 5, it just means, okay, this area needs a closer look.
97%. Just look at that number for a second. It's incredibly important, and it really speaks to how reliable modern imaging can be. So here's what that number means, and this is such a key point. When both a mammogram and an ultrasound come back showing no concern, meaning the results are negative or clearly benign, that result is over 97% accurate. It's a really powerful number that gives you an extremely high degree of confidence that there's nothing to worry about.
But what happens if the imaging is suspicious or just isn't totally clear? Well, that's when we move to the next phase of this journey, getting a tissue sample, which is what gives you a final, definitive diagnosis. When it comes to getting a tissue sample, there are two main types of needle biopsies. On one side, you have a fine needle aspiration, or FNA, which is often used to drain fluid from a cyst or just get a few cells. On the other side is a core needle biopsy, and that takes out a small, solid piece of tissue. For solid masses, the core biopsy is really considered the gold standard because it gives the pathologist a much more complete sample to analyze for an accurate diagnosis. And this brings us right back to that BRAD score we talked about. A biopsy is typically recommended for scores of 4, which means suspicious, or 5, which is highly suggestive of malignancy. This is the step that provides the final, concrete answer. No more guessing.
Now, this is so important to remember. The vast majority of breast lumps are not cancer. Here are just a few of the most common benign or non-cancerous findings. Things like simple fluid-filled cysts or fibroadenomas, which are really common, especially in younger women. Getting a benign result from a biopsy happens all the time, and it's obviously a very welcome outcome.
So what if the result is cancer? Then the path shifts from diagnosis to treatment. This phase is all about understanding exactly what you're dealing with, talking through all the options with your medical team, and making the best decision for you.
For early-stage breast cancer, there are generally two main surgical options: lumpectomy and mastectomy. Now, both are highly effective, but they come with different trade-offs. A lumpectomy, or breast-conserving surgery, aims to save the breast, but it usually means you'll need radiation afterward. A mastectomy removes the entire breast, and you often don't need radiation, but it's a much more extensive surgery. This is a deeply personal decision, and the right choice really depends on your specific diagnosis, your health, and frankly, how you feel about all these options.
And this really brings us to the most important takeaway of all.
Throughout this entire process, from that first moment of discovery to a final treatment decision, the whole goal is to give you clear information. Why? So you can take the time you need, figure out how you feel, and make the right decision for you. Your voice, your feelings, and your preferences are what matter most on this journey.